Hello, my name is Erica Johns, and welcome to my research proposal. Today I'm going to be presenting to you a research proposal that looks at probiotic supplementation in women with gestational diabetes. So why is gestational diabetes important? Well, within the past decade, it's becoming increasingly more common. Approximately 50% of women who are diagnosed with gestational diabetes end up developing type 2 diabetes within the first 5 years postpartum. There has been studies that show that different probiotic supplementation can actually help glycemic control. So that is what we will be looking at in this research study. The research question. In women with gestational diabetes, does the use of probiotic supplementation decrease the risk of developing type 2 diabetes postpartum? Past literature review. There has been quite a bit of research come out within the past decade since gestational diabetes has been more common, just about the risk factors of type 2 diabetes, whether or not probiotics use during pregnancy is good or if the good outweighs the bad, and what the benefits of probiotic supplementation is for women with and without gestational diabetes. The gap in research that I found is that there's no follow-up to whether there is a correlation between probiotic supplementation during pregnancy and a decreased risk of developing type 2 diabetes postpartum. So the methods for my research. First, it will be a randomized controlled trial with two groups, a group that will receive an intervention and a control group. So both groups will be receiving pill forms. One will be a placebo and one will actually be the probiotic. So the intervention group receives a lactobacillus probiotic strand, and they will be taking that dose daily. And the control group will be taking a placebo daily. Each group will have to follow a diet plan just to ensure that their diets are similar with carbohydrate intake and fiber intake. And then there will be analysis of hemoglobin A1C levels over the 5-year period to determine if there is a raise in blood sugar or decrease in blood sugar between the control group and the group that received the intervention. And then just to determine if the probiotic was working during the pregnancy, we'll do an initial blood test at the end of pregnancy to determine microbiome health of all the participants, just to have a baseline if the probiotic is working or not. So for data collection, data will be collected through blood tests to check hemoglobin A1C levels of all participants every 6 months. So hemoglobin A1C determines what your blood sugar range has been over 3 months. So 6 months just gives the participants a little bit longer span, and we'll check that. Then we'll compare the initial microbiome health from the intervention and control group just to see if there's a difference at baseline in the microbiome itself. And then for recruitment strategy, ideally, we would like to recruit 169 participants. That includes a 20% attrition rate as they're to call for dropouts or anything that might occur during the study. This was all determined through G-Power. Then we're going to discuss the research study with obstetricians in this tri-state area so they can relay to their patients whether or not they would like to participate in the study. And then once participants are gathered, there will be surveys to evaluate further if the participant is appropriate for this research. So inclusion factors for participants. They're 24 weeks or greater and are recently diagnosed with gestational diabetes. Ideally, within the first 2 weeks of diagnosis, we would like the participants just to know that there's no intervention already being used rather than the probiotic or not. And then the age range, I would like to be between the age of 20 to 45 years old. Some exclusion factors include initiated treatment for gestational diabetes, say they use insulin or any other like metformin, any other treatment method so far. And then high-risk pregnancies, and then previous health issues would exclude participants from this study. Anticipated results. So the hypothesis for this research question is that those that receive the intervention of the probiotic will have decreased hemoglobin A1C levels throughout the 5 years. And then also there will be a decreased number of participants that develop type 2 diabetes in the group that received the intervention. That kind of goes hand in hand. Some strengths of the study and some limitations include it has the potential to prevent the development of type 2 diabetes for women at risk. So that is a major health issue that there might be a new preventative method for. And then it also just provides information for if there is a true correlation between probiotic supplementation and glycemic control. This could help in later studies, not just in pregnant women. And then some limitations are that pregnant women are a vulnerable population and many may not want to participate in the research due to unforeseen risks. And then the study is actually rather lengthy. It's 5 years, but that's just how to determine if type 2 diabetes is going to be developed or not. All right, ideas for the future. Like I said, further studies can be determined if probiotic supplementation can decrease the risk of developing in both men and women, so you can go on to further test that. And then use of different strands of probiotics can also be used to see if there's a difference in that for pregnant women. All right, that is it. Thank you so much for your time.